Who is Princess Gore? I am a wellness coach, a nutritionist, as well as a detox specialist. I have been coaching for over 5 years. The reason I started this is as a result of my observations of people that I have been seeing, and also how my body reacts to food. I love cooking and I love eating good food. My passion is to heal the body through the use of food and good food. Our weekly talk is now changed from Wednesday to Thursday. So our talk would usually be every Thursday from now. Next week, we are talking about candida and leaky gut. The week after, we will be talking about how you can reduce inflammation in your body. We'll talk about lupus and the Black woman. I have been speaking to quite a few people, and I've noticed that many people, especially Black women, have lupus. Some people have been living with it for years. I listened to a story of a woman that had lupus for over 15 years, only to be diagnosed after 15 years of treating different ailments. I'll also be talking about arthritis and different types of arthritis as well. Some of the services offered by Guerrero Nutrition are health consultations and scans. We also have essential oil. We have skin and body care products. We do seminars and workshops, meal plans, ready meals, and cooking classes as well. For tonight's talk, if you have any questions, please pop them into the chat. We'll also be putting extra information that will be required for your further information about the product and services we offer. Tonight's talk will be on gut health, sleep disorders, how diet affects your sleep, signs of sleep disorders if you have them, types of sleep disorders that are available, and how sleep positions can improve your gut health, and ways you can improve your sleep, things that you can do, maybe products you can buy, as well as diets that will improve your gut health. So what is gut health? We started talking about it last week. Gut health describes the function and the balance of bacteria in your digestive tract. So organs such as your esophagus, your stomach, and intestine, they all work together to digest the foods that you eat. One fact is that 80% of your immune system is located in your digestive tract, making it a healthy place to live and making you a healthy person as well. Your gut is always trying to tell you something. So sometimes you hear your stomach making noise or your stomach being very quiet or growling. It's as a result of what is happening in your gut. And also your gut also influences your meal choices as well as your mood. So what are some of the things that affect your gut or that destroys your gut? The first one is antibiotics. I know for many people, when they have an infection, the first thing they do is go to their GP, and the GP gives them antibiotics. They're happy to take it for a week or two. For most of the clients I have seen in recent times, when they take antibiotics, it destroys the good bacteria in their gut. It also disturbs the balance of the good and the bad bacteria, making the bad bacteria grow more in their system. Another thing that affects our gut is sugar. For many of us, we have sweet tooth. We like to eat chocolate, we like to eat sweets, biscuits, and all those nice things that are sugar-filled. They affect your gut as well. Another thing that affects your gut is GMO. Every time I see my clients and I say to them, stop eating rice, and they're like, why? Basmati rice is really nice. I say to them, basmati rice is GMO. And they're like, what's that? Like genetically modified organism. So the rice is not real rice. So for those of you that are enjoying basmati rice, I'm not saying you shouldn't eat rice, but you're not eating real rice. Pesticide is also another problem that affects your gut. And for many people, when they come to do the scan, we also tell them about the pesticides. I did a scan for a lady today, and one of the pesticides that came up for her was in the products that she ate. And one of the products that she ate was cucumbers, mango, avocado. So those pesticides came up for her, and it was quite high as well. So that was really affecting her stomach. Toxin is also another thing that affects your gut. Gluten, for those people that like eating bread, big things, it affects your gut as well. Tap water. I know you're going to ask me, what should I be drinking? Drink water, filter your water, boil your water, whatever is easy for you, will help with your gut health. Also, stress is also another gut health killer as well. So if your gut is unhealthy, your body cannot break down or digest your food. If your gut is unhealthy and imbalanced, your immune system simply cannot function at full strength. Doctors always prescribe antibiotics, like I said earlier, but it does kill the good digestive bacteria. Your gut is responsible for regulating your weight as well as your metabolism as well. And also your gut is also linked to your brain. We spoke about that last week. Another thing I just wanted to mention whilst mentioning about the things that affect the gut is sugar. One of the things that sugar does to your system is not only destroy your gut, it also causes hypersensitivity, it causes anxiety, it causes difficulty in concentration in children and also in adults as well. It leads to cancer of the ovaries, it leads to skin problems in children like eczema, it contributes to obesity, tooth decay, arthritis, asthma, heart disease, hemorrhoids, PMS. For those people that suffer from PMS, it makes it worse. Somebody's saying that, you know what, I don't eat sugar, but I take Splenda. So I thought, you know what, let me tell you some of the side effects of using Splenda instead of sugar. You will get migraines, you have acne, you have bloating, you'll have gum bleeding, chest pains, headaches, rashes, and dizziness. Also, the dangers of taking Splenda is that it reduces the good bacteria in your gut by 50%. It also increases your pH level in the intestine, slowing down your digestion. It contributes to increase in body weight. Splenda is also meant to cause lesions in your liver and your kidney. So about 7% of Splenda remains in your body 5 days after consumption. So can you imagine you taking a replacement for sugar and it's still in your body 5 days after taking it? So what are the damages that sugar does to your body? Again, remember we're talking about the gut, but I just wanted to mention the two things that I thought was affecting your gut, and one of them was sugar. It would cause eye damage, it cause kidney damage as well, it will cause stroke, it will cause heart disease, it will cause problems with your feet, and your nerves will be damaged. Some of the other toxic effects of sugar are Alzheimer's. For many people, some people are beginning to get it as young as 30. Diabetes, tooth decay, candida overgrowth, kidney disease, depression, various types of cancer, constipation, fluid retention as well is as a result of too much sugar that you are consuming. So what are some of the stomach problems that cause sleep difficulties? One is indigestion. For many people, you eat a certain type of food and you have indigestion. Recently, I went to the pharmacy to find out if there's an indigestion product that normally doctor recommend. It's called Zantac. It hasn't been in the shop for 3 years. That goes to show that lots of people have this problem, but they're not medicine to even help with the situation. I know for many people that had that situation, Zantac was a very good product and doctors used to recommend it. So indigestion encompasses a wide range of symptoms such as heartburn, gut disease. Having indigestion makes it difficult for you to sleep. It's also very uncomfortable as well. You're not able to sleep in certain sleeping positions. You often wake up more than once or twice in the night. So some people, constipation is also a problem that affects their sleep. So if you're having trouble sleeping or feeling constipated, it's related to two things. You're not eating plenty of fiber. So you're not eating a lot of fiber in your food, and also stress related. Another reason why constipation is a problem for you is because of dehydration. So many people say to me, well, I drink so much water. You're not drinking enough. Especially people that are on our program, for example, they say, oh, somebody said to me yesterday, you know what, I drink 3 liters of water. That's enough water. I don't need any more. But we always encourage our clients to drink at least 5 to 6 liters of water a day. The reason why we do that is because it helps with your kidney. It also helps you to be fully hydrated. That's one of the reasons why we ask people to drink lots of water. Heartburn is also another issue that affects your sleep. And it's also linked to gut disease as well. Acid reflux is also a problem that affects lots of people sleeping. GERD disease is common amongst men and women, but many of these sleeping disorders affect women the most. People who are trying to sleep with GERD disease are always often not able to fall asleep on time. So they're lying down there, watching film or doing something else just to try to sleep. And if you have GERD disease as well, it wakes you up with coughing or choking. IBS is also another very popular stomach inflammation disease that affects people's sleep. And patients with this have reported that they've had health challenges and they've not been able to sleep, and they've complained about digestive troubles as well. Another inflammatory bowel disease that affects the colon and the rectum area is ulcerative colitis. This affects you in such a way that you have pain and cramps in your stomach and you're not able to sleep. Sometimes you have a bout of diarrhea, and that also will result in you not being able to sleep throughout the night because you are going to the toilet more than normal. To help with this situation, we've got a combo that I can recommend. It's called the Gut Health Combo. We've got leaky gut health repair for those people that have leaky gut issues. I would also recommend that you take probiotics. If you do take it before meal or after meal, it does help a lot with putting a lot of good bacteria in your gut. SOS is a product that we have that is good for cleaning your blood. OxyFlush will clean your colon. So again, all these products, if you wanted to get them today, you can purchase them for £162, but it's usually £180. Okay, that takes me to my next point. How many hours do I need to sleep as an adult? For adults, it's 7 to 8 hours. For teens, it's 9 to 10 hours. For people in school age, it's 10 hours. For younger children, it's 11 to 12 hours. For newborn babies, it's 16 to 18 hours. I know people listening to me and saying, oh, you know what? I haven't had 7 to 8 hours sleep for years. Try your best to increase your sleep as much as you can. So are these problems affecting your sleep energy? Insomnia is one problem that is the main sleep problem. So primarily insomnia is when somebody is not able to sleep just for general reasons like, linked to health problems. Another type of insomnia is secondary sleep insomnia. And this is obviously as a result of you having asthma, depression, arthritis, cancer, and heartburn. Another type of insomnia is insomnia that lasts for one night or a few weeks. About 1 in 3 adults has insomnia that lasts for a few days at a time. And there's also some set of people that have what we call chronic insomnia. This obviously persists for a time as long as a month. 10 to 15% of adults will suffer from that, which means that they only get to sleep 3 nights a week. So from the research I was doing today, I have found out that insomnia affects women and older adults more than men. This condition may continue to affect you for days, weeks, and months. And one of the reasons why for women is because they're stressed and they're going through menopause, or they're taking certain medication, or just mental health issues. So what are the 5 common types of sleeping disorders? We have insomnia, which we've already told you the different types of insomnia. And we have sleep apnea. So breathing repeatedly starts and stops. We have hyposomnia, we have narcolepsy, and we have parasomnia. So these are another type of sleeping disorder that affect people. So insomnia is defined by a combination of factors, including inability to fall asleep. Sleep apnea is temporary cessation of breathing throughout sleep. And snoring is also another reason why people will not sleep throughout the night. And also, narcolepsy is excess daytime sleepiness, resulting in urge to sleep in times that they're not meant to. And one other thing I discovered today was restless leg syndrome, where your leg just has the urge to move whilst when you're sitting down or you're resting. Okay, so what is chronic insomnia? A long-term pattern of difficulty sleeping, which can relate to respiratory disorders or muscle problems. So symptoms of sleep disorder for some people are unusual breathing patterns, unusual movements, or other experiences while asleep, impaired performance at work or at school, lack of concentration or depression, weight gain or weight loss, unintentional changes to your sleep or wake schedule. For some people that have sleep disorder as well, you know, some of them do night shifts. That's another thing I found from my research. So what does insomnia cause? It causes pain, it causes heart conditions, memory loss. What causes insomnia? Medication will do that. Mental health, lifestyle will cause insomnia. Insomnia sometimes is caused by a change in situation. Maybe you've just recently lost your job, or somebody's died in your family, or divorce. Sometimes noise can affect people during the night or during the day. Temperature as well can make people not to sleep. Jet lag can also cause insomnia as well. Pain attacks or stress disorder could also affect and make people to have chronic insomnia. Alzheimer's disease can make people have insomnia as well as Parkinson's disease. Okay, what are the symptoms of sleep apnea? Night sweats, frequently visiting a bathroom at night, restless sleep and weakness, pausing in breathing, loud snoring, loss of sex drive, daytime sleepiness, memory, concentration, or attention problems. Early morning headaches, waking up with headache is also another problem of insomnia, or waking up and feeling like drinking water is another problem with sleep apnea. How gut health affects your sleep. The bacteria in your gut reduces serotonin level, which interferes with your sleep. 90% of the serotonin is made in your gut. Serotonin helps regulate your body clock. Serotonin is needed to make melanin, and melatonin is good sleep hormone. So again, if your gut is not right, you will not be able to make those sleep hormones that make you to sleep. Your quality of sleep affects the gut bacteria as well. So what's happening to my body when my body is deprived of sleep? Poor memory. You're always forgetting things, poor ability to think or concentrate, emotional irrationality, weak immune system, risk of developing cancer, risk of developing blood pressure, heart attack and stroke, and also weight gain and fertility issues, and also the risk of developing diabetes. The next thing I just wanted to say quickly is sleep positions. What positions are best for sleeping? From the research I was doing today, one of the positions they mentioned was sleeping on the side, not on the right side, but on your left side. So this is a picture of a correct sleeping position, the first one. The second one is incorrect. For most people, they would have 2 or 3 pillows stacked up so that they're able to sleep properly. And so we end up sleeping and destroying a little bit of our spine. So if you're sleeping in this position, the third position or the second position is a wrong position to sleep. Also, there are other types of sleeping position that will help if you are in pain. If you have shoulder pain, this is the way you need to sleep. If you have back pain, you need to sleep on your back with pillow underneath your legs. If you have high blood pressure, you sleep on your stomach. If you have sinus issues, you sleep with pillows raised, but on your back. If you have headache, sleep on the back. If you have heartburns, you sleep on your left side. If you have neck pain, you sleep on that position. If you have digestion issues, you sleep on your back as well. And if you have PMS or period pains, sleep on your back. There's something I actually want to recommend. I don't sell pillows, but I find that using a very good pillow will help with your sleep as well. And this is a pillow that I use. And I thought, I'll just add this into the blend. So it's good for you to get a special pillow for your sleep so you can sleep in the correct position. And that will also help with good sleep. So other positions of sleeping Are these on the picture here. So if you had heartburn, you sleep in this position. If you have back pain, in this position. If you have neck pain, you'll be sleeping on your back, and insomnia, you'll be sleeping on your back as well. The next point is, does exercise help or improve my sleep? Yes, it does. And what kind of exercise? I'll be going through them in a minute. So yoga is very good to help you sleep. So you can do some stretches. Child pose is one of them. Standing forward fold is another. Sitting forward, lying down and doing a spinal twist is another. Cat and cow stretching is another. Legs up on the wall will help circulation as well as help you to sleep better. So moderate exercises will help you to rejuvenate and also decompress your mind as you prepare to sleep. So for those people that do shift work, we encourage you to do a lot of walking, walk up and down the stairs or stretch before or after your shift. That will help you to sleep. And also when you do have breaks at work, if you're doing a night shift, try your best to take some sleep. Do try to get enough sleep. And also you need to practice proper sleep hygiene by making sure that the lights are put out at a certain time so that the room is dark. You could also use a sleep mask as well. People do night shift or shift work should also take extra time to block out daylight so that they're able to sleep after work. Other things that you could do to help your sleep are stretches. So you can stretch before you go to bed by doing a bear hug, neck stretch, kneeling at the lat stretch, child pose again, sitting forward and bending down. And all sorts of stretch on this picture are useful to help you to get a better sleep at night. And also to help you to get better sleep, you need to try to do some workout during the day. So we've talked about yoga. You could do some cardio as well. That will help you to sleep at night. And what are some of the foods that will help you to sleep? Eating cherries. I eat a lot of cherries. Eating cherries is good. Eating oats. Eating grapes, eating walnuts, almonds, broccoli, collard greens, banana, garlic, and dates. In terms of eating date, one date is enough. By the time you eat 3, you've already had like 7 cubes of sugar. So if you were thinking of having dates, just have 1, that's fine. You could have chamomile tea as well. That's good to make you go to sleep. Sweet potato is also good. It helps to relax you and promote sleep. Bananas, we said already. So these are some of the things that you can have that will help you to sleep. Other tips I wanted to share was that eat light at night, eat heavy lunchtime or in the morning. Set a sleep routine, go to bed at the same time every time. Maybe you set the alarm to go to bed at 9 o'clock or 10 o'clock every night. Exercise regularly. If you don't want to go to the gym, you can do a walk. Walk up and down the stairs, like we said earlier. Meditate to clear your mind. Avoid late night screen time. So I suggest you put your computers or your phones away maybe an hour before so you can get good sleep. Take a nap when you need to. Cut down on alcohol and cigarettes. No caffeine in the second half of the day. That means after 12 o'clock, do not drink anything that contains caffeine because that would obviously keep you awake. And also, do not set the alarm so that your body wakes up naturally. So we have some products that help with sleep. That is Menovate, that helps to calm you down and also helps you to have good night's sleep and relaxing sleep. We also have a product called Go Sleep that also helps you to sleep. And we have Respirate, which you can put in your diffuser and also apply on your skin or on your pillow. I use Menovate every night and I use Respirate at night as well before I go to bed. Things that can help you to sleep as well. We said drink lots of water, eat lots of fresh fruits, no processed food. So do not eat any processed food. Chew your food and relax while you eat. Don't overeat as well. And at night, keep the meals light or small. For tonight's talk, for anyone that has attended the talk and would like to book a scan, We do online consultation as well. So if you've logged in from another country, we do online consultation. I can give you a 15 minutes free consultation online. I'll send the app for you to book that. If you wanted to come to the office, we'll give you 10% off. And so instead of paying £150, you'll pay £135. We also have a meal plan service for those people that have blood pressure, diabetes, and would like to know what to eat for breakfast, lunch, and dinner. And we have meal plans for 21 days or 30 days if you wanted to make use of the service. You can do by texting me on 0798 455 1292. Thank you so much for listening to the talk. I'm just going to check the chat now to make sure I'm able to go over all the questions that have been asked. Thank you very much, everyone. And for staying to the end. I'm just going to go through the stuff if you have any questions. Okay, if anyone has any questions, you can ask, or you can put your hand up to ask. Thank you, Claudette Walkers, for joining. Thank you, Cara, for joining. Okay. Eglantine, if you have bacteria in your gut, the first product I would recommend is taking a live probiotics. That will really, really help to quench some of those problems. But I think you can come and do a scan with us if you want. And if you've also developed lupus as well, we've got a service that we offer for lupus that can help with that. 5 to 6 liters of water, could this lead to? No, drinking lots of water will not lead to fluid overload. So you can drink as much as possible, and all you will need to do is just go to the toilet more times than normal, but you will be fine, Helen. Thank you for asking that question. It's just going through the stuff. Okay, Bishop has answered the question, so yeah. Question has been answered already. So if you're taking 5 to 6 weeks as part of the program, the process of hydrotherapy, it's recommended that you take a lot of water to flush out toxins from your system and strengthen the muscles of your kidney as well as your bladder. Okay, 1 dose of antibiotics can wreck your gut flora. If you've had 3 doses, that would obviously cause overgrowth of harmful bacteria in your system, which could lead to inflammation. It can lead to lupus, as well as leaky gut syndrome. Right, cool. Thank you very much, Juice Doctor, for answering some of the questions, making it easy for me. Jay, you've got your hand up. Do you have a question? I don't know who this Jay is. Jay, you've got your hand up. You want to ask us a question? Yeah, what's the question? Go ahead. You have to unmute yourself.
Can you hear me now?
Yes, I can.
Oh, hi, thank you. Sorry, apologies. I've just spent a spell in hospital, and I was given antibiotics intravenously. Now, two of my problems, I was drinking quite a lot of water, and I ended up having to have some infusions because they said I was drinking too much water and I'd flushed out all the nutrients out of my body.
So how much water were you drinking? 8 liters or 6 liters?
About 8.
Oh, okay, probably that's why. But 5 to 6 liters is what we recommend anyway. Were you eating as well?
I was, but the thing is, I was really unwell. I'd had cancer and stuff as well, so I was quite poorly. So I was struggling to eat food, but I was still trying to drink.
Oh. I think that's probably why, because obviously if you're eating, it obviously helps with, making sure that the food that you're eating is getting to the parts that it needs to get to. Because don't forget, your body is 70% water as well. So your body does need a lot of water to cushion your joints and your body as well.
Okay, well, I've just had a stint of obviously intravenous antibiotics. Is there anything you could recommend that I should be doing right now?
Yes, there are lots of things I could recommend, but can I speak to you outside of here so that I can recommend all this stuff? Because obviously, this is personal to you, and then there might be other things I would like to know as well.
All right, bless you. Thank you.
Thank you very much. My number is on the chat, so you can call me and I'll tell you a bit more. Thank you
All right,
so
it might
much.
not be this evening, but it will be tomorrow if that's okay.
It's fine. Just text me so I know that it's you. That's fine.
Okay. All right, bless you. Thank you.
Thank you very much. Yeah.
Thank you. Bye.
Yeah, thank you. Helen, yes.
I'm having problems sleeping, and I thank you very much for all the tips you've given me, and I can see why I'm not sleeping. But I tend to have, as long as I get 4 hours sleep a night, I'm fine in the morning. But come mid-afternoon, I start feeling really tired. Then I have a glass of water, or a couple of glasses of water, and then I get my energy level back. But I just don't know how to get back into this pattern of sleeping. So I know you said a few things, but how can I get back into my pattern of sleeping immediately without having to, just immediately? How can I get back into the pattern of sleeping? Because I only sleep, I go to bed at 2 o'clock in the morning, practically every day.
Can you go to bed early? What time do you normally go to bed? 10, 11?
No, 2 o'clock in the morning, or 1 o'clock, 2.
Okay, Helen, you need to start going to bed at least half an hour earlier than 2 o'clock every day so that you're able to get enough sleep. Do you watch TV in your bed or in your room?
I don't watch TV at all.
Okay.
I just find I have a lot of energy towards the end of the evening. I just can't sleep.
What time do you take the products that you get from us?
Morning. I haven't been taking them as much as I used to be honest. I take my vitamin C, I take my total foods, and mostly the morning, first thing in the morning.
Okay. So in terms, do you have Menovate?
No.
Okay, Menovate is a product that we do to help people to sleep. You can use that during the day as well. It'll calm you down, and in the evening you just apply it before you go to bed. We've also got another product called Sleep Tonic. You can apply that one. It's a roll-on. You apply that one, and you'll go to bed. I think within 10 minutes you'll go to bed.
Okay, brilliant.
So you can try that. Yeah. Yeah, that will help. But what you could also do is, try your best not to be on your phone. For many people, they put their phone on their bed as well.
That's what I do. I have it next to me.
So you're putting a lot of radiation in your body as well. So that will not let you sleep. So if you're having your phone on your bed, reading stuff, watching stuff on your phone, you will not be able to go to bed. And that's one of the reasons why you're going to bed at 2.
Yeah, I have it next to me. That's a good point, actually. I have it with me next all the time, 24/7. Yeah.
So that obviously affects your brain as well.
Yeah. Well, thank you very much, Princess Glory.
Thank you, Helen, for asking the question. I'm sure lots of people probably had the same question. So what you could do is you can go to bed 15 minutes earlier every day, and that will help you to go to bed. So it will change your routine for going to bed, and then you'll go to bed much earlier, much better. And you sleep, you find that you sleep longer. So Menovate also is a product that when you use it, even if you had 4 hours sleep, you'll feel like you've had 8 hours sleep.
Yeah, okay. Thank you.
Thank you, Helen. I think that's it. I've answered everybody's question as much as I can. And my number is on the chat now. I've got a Telegram channel as well, and I will be posting stuff about sleep all of this week on there. And I've posted a couple of things on the channel already. The video for today's talk will be posted on there as well. We will be doing a talk next week about Candida. And I know that that's also another thing that affects women as well. Thank you so much, everyone, for joining. See you next week at the same time, 8 o'clock. Have a nice evening, everyone.
Bless you, and thank you again.
Thank you, Jay. Have a nice evening. Thank you, Marilyn, for joining.
Thank you. Bye.
Very useful. Thank you.
Thank you.
Thank you, Princess Glory. Bye.
Thank you. Bye.
3,500. Good night, Princess Glory. Thank you.
Oh, thank you, Batu. God bless you. Thank you.
That's great, Princess Glory. Thank you.
Oh, thank you, Sharon.
Great
Thank you.
presentation.
Thank you, Amanda,
Thank
for
you.
joining.
I missed the first
you.
one.
Thank
Is there the
The
recording?
video. I'll send you the
Yeah.
video for the first one, the one that I did. Yeah.
Thank you. Have a blessed evening.